Welcome back to Healthy, Happy, Wise, Wealthy. I am so excited for our guests today. We have Comprehensive Home Health Solutions in Reno, Nevada area, and Dr. Sandra Weitz and Carrie Ingerman are joining us today. They are a mother-daughter combo. That's easy for me to say. Um, so I have been working with them for a little while now and just adore them and so appreciate the insights that you both have in terms of like helping people as they age. So I know you help people with home health and then medical or non-medical, either way. But could you guys just introduce yourself briefly for us and tell us a little bit about your background?
Go ahead, Carrie.
Okay.
So I'll go first. I'm Carrie. I have a long history of being interested in patient advocacy, which started really from my own experience with the healthcare system. As I'm sure my mom will go into detail, she is a physician, and one of the reasons that I am where I am today in terms of my abilities and not having significant consequences from my medical history is because she was able to advocate for me. And so one of the things that led me to senior care and advocacy is my own experience. I went to Northwestern University and studied learning and organizational change and am very interested in uh, helping people navigate the healthcare system. And I'll let my mom
Yeah.
introduce herself, and then we can share about how we started our agency and how we got into really helping people live well at home.
Yeah, I love that because I don't think I knew that the patient advocacy piece came because your mom was such a good advocate, but I can see that happening. So, Dr. Weitz, do you want
So
me to call you Dr. Weitz?
you can call me Sandy. I,
Okay, I
I
will.
I answer to everything at this
Okay.
point,
Hey, you, right? Yeah.
including hey you and hey. In any case, so I am a double board certified pain management specialist. I did a surgery internship, anesthesia residency, pain management fellowship, all at UCSF in San Francisco, and stayed on faculty there for 5 years running the pain service. I moved to Baton Rouge, Louisiana with Carrie's dad. He is actually the silent member of Comprehensive Home Health Solutions, but a very active member. I actually met him the first day in medical school. He was the guy sitting behind me 41 years ago.
Oh,
And so basically, moved to Baton Rouge, started my own practice, grew it to 11 docs and 11 mid levels, and ultimately ended up retiring in 2016 after number one, having taken care of Carrie and her multiple medical issues, and then ultimately in 2016 taking care of my mother-in-law who was dying of metastatic breast cancer, and my elderly father-in-law. My husband is an only child. um, Very long story short, we were traveling the world, minding our business, had moved to northern Nevada, and really enjoying just living and dealing with our three kids when Carrie said, you know what? I originally wanted to be a disability rights attorney, but you talked me out of doing that. And then we can talk about why. So, what does one do
okay.
when they don't become a disability rights attorney? You go to work for Goldman Sachs as an investment banker for 4 years in New York City. And
Did you do that? I don't think I knew that.
I
That's
did, in
awesome.
fact, do that. And after 3.5 years, I realized that I wanted to get back to helping people. And around that time, we had close family friends diagnosed with terminal illnesses, one with ALS, one with Parkinson's. And it was kind of that moment where I understood how challenging and navigating end of life care is. And when I say end of life care, I'm not talking about terminal care. I'm talking about when you're diagnosed with multiple chronic diseases and your quality of life or your ability to navigate life becomes more challenged. How do you
Um,
how do you have the supports? And so that is really where Comprehensive Home Health Solutions was born, was really trying to provide coordinated care in the home to help people have the best quality of life, to provide supports for their friends and family caring for them. And for some crazy reason, my mom and dad agreed to go on this journey with me. And so we started the licensing process about 2.5 years ago, and we started providing caregiving services in the home 2 years ago, as of about 2 days ago. So it's been quite the journey, and now we are ACHC accredited, and credentialed with Medicare for home health. And we also offer patient advocacy. So really trying to,
Yeah.
again, provide that coordinated care in the home.
I
So-
love that.
But Mary, I want to clarify a couple of things, because I think Carrie and I come at this from a slightly different perspective, even though we're mother and daughter and there's usually not a lot of daylight. Number one, while many of the folks that we take care of are indeed seniors, there are plenty of people. Illness and disability does not affect only old people. That you can become disabled, you can get diagnosed with some significant illness pretty much at any age, including
That's
Carrie,
true.
who was 18. All right. And
Mhm.
so the idea that we do senior care, a large portion of what we do is senior care, because as we get older, we're more likely to have illnesses, we're more likely to need support, but it is not limited in any way, shape, or form to only old people, number one. And number two, I want to be really clear in the explanation of home care versus home health. Because I think a lot of people don't understand the difference between those two things. So when Carrie says that we have been providing home care for the past 2 years, that is really the non-medical side. All right.
Okay.
And what I mean by that is activities of daily living, getting dressed, getting showering, bathing, toileting, meal prep, going to doctor's appointments, all the things that allow you to live your life that you may not be able to do independently, and you may not necessarily have the family or social support to enable you to do that. That's really what home
Yeah.
care is.
Right.
On the other hand, home health is the medical arm. Skilled nursing, PT, physical therapy, occupational therapy, speech therapy, really skilled services. And for home health, you need a physician order, and it's covered by insurance. Whereas on the home care side, that is something that anybody who understands that they have a need or a family member has a need can arrange for, even without a physician being involved.
Yeah.
And I think that as a doctor, I will tell you that doing both home care and home health has been probably the most humbling experience. And the reason for that is that when we see patients in a clinic setting, it's very sterile, right? We see you for 10 minutes, 15 minutes. We tell you a bunch of stuff. Even if you are able to tell us back what you heard us say, you may or may not actually comprehend that. You may not
Mhm.
remember it by the time you get home. And so then sometime later, you come back either to see us in the office or you end up in the hospital, whatever it is. And I'm sure your listeners will acknowledge that they've heard physicians or healthcare providers say, oh, that patient is non-compliant. And it's not until you do home care and home health that you realize that most people actually really want to do the right thing. And they really do want to be taken care of and have the best care possible, but they don't have the resources. They don't have the social support. And so once you get out into the world, right, it's a very different environment than when you're sitting in a clinic. And the other thing is that people do themselves a disservice because they frequently want to put their best face forward, and they tell us they're doing stuff or they understand stuff when they don't. All you have to do is think about, maybe your mom who or a friend of yours who gets dressed to the nines, puts on their makeup, and going to the doctor looks totally put together, and yet you see them on another day and they haven't gotten out of their pajamas, but they don't want
Oh,
the
yeah.
that.
That is an interesting thing, I imagine, because it's a completely different setting. So, and I know today I wanted to have you guys on the week before Thanksgiving because there is this going into, aging. I know this can be for other people. Maybe it's not aging, it's health related, but you're going home for the holidays maybe, and you're going to see some relatives you haven't seen in a while who might be aging. And I know you guys give talks out in the community, and you just gave one about staying safe during the winter. But are there things like when you go home and it's over holidays and you're seeing a parent or a family member who is, getting up in years, are there things to look for?
So I think one of the biggest things to look out for is changes in cognitive status. And that's kind of the high level idea, but when you talk to your parents on the phone, or your grandparents on the phone, you might talk to them for 5, 10, maybe even 30 minutes, whether it's on
Hmm.
phone, by phone, or on FaceTime. You're getting a very small snippet. And one of the things that I have found is that people are really good at faking how well off they are. And so the opportunity to spend prolonged time with your loved ones is a great opportunity to kind of assess their cognitive status. So when you talk to them on the phone, they may have a typical conversation, but after 30 minutes, an hour, you might notice that they are on a loop, that they are having the same conversation with you that they had an hour ago. You might
Hmm.
notice that they are fixated on different topics, whether that is, oh, I need to do laundry. I need to do laundry. And even after you've addressed laundry, they may still be fixated on that. So that's something to look out for. You might notice forgetfulness, or confusion. Another thing is, especially for people with cognitive changes, is change in routine can be really disorienting. And having a lot of family in town might be disorienting for them because they have established a very specific
Hmm.
routine. And so if they become anxious, if they become confused, those might be signs that they are disoriented. And
Hmm.
so by spending more time with people, you'll be able to get a better understanding of what their cognitive status is.
Yeah, so we probably should be checking in with relatives more than just on holidays is also what I'm hearing, and be or it might be neighbors or whoever that might be, but if we see something we're like that's not great, what do you recommend doing? Either one of you can.
Well,
I
I think
mean,
I think some of it depends on how acute it is. All right. So I want to come back to a couple of the things that Carrie touched on. Um, when she talks about a loop, right? You may not even recognize the loop, and whether you're home for the holidays with them or you're just talking to them on the phone on a regular basis, be aware of the conversation you're having. If you constantly ask somebody questions that really are yes, no questions or things that can have a very simple answer, you may not recognize how impaired that person is. And so, it, because if the question is, so are you having a good day? Oh, yes, I am. I mean, I can have a whole conversation with you and say nothing, right? So
yeah, that's
aware of
true.
be aware of the conversation that you're having. The other thing is that it's very hard when you really haven't seen this person for 3 months or 6 months and haven't had any in-depth conversation to figure out what is acute versus not acute. And what I mean by that is somebody may have a gradual decline, and frequently those cognitive changes are relatively gradual. Sometimes, however, it can be a sign of, let's say, a urinary tract infection. One of the most common presentations of urinary tract infection in an older person is actually change in mental status, confusion.
Hmm.
So if you normally are talking to your loved one and they're with the program, and all of a sudden they're making no sense to you, they need to go to the ER immediately.
That
Right?
makes sense. Yeah.
Because, they could be having a urinary tract infection. They can have ischemia, meaning inadequate blood flow either to their brain, to their heart. They could have a heart attack. They could be having a stroke. And so, it becomes very hard for family members who don't see their loved one on a regular basis to kind of ferret out what's new, what's not new. And that's where, are their friends around? Do they go to church? Who else are they interacting with, so that you can get some other data points to really recognize kind of what we're dealing with. That's number one. Number two, anxiety and depression are very frequent symptoms of cognitive change.
Mm.
And one of the things I've learned as a physician over the years is that depression and what people perceive as dementia or cognitive change can be two sides of the same exact coin. I have historically seen in my own practice, people where you thought they had cognitive changes and you thought they're depressed, you treat their depression, the cognitive changes get better. Similarly, if you are aware that you have cognitive changes, and most people who have slow decline are very well aware of it. They may not be articulating it to you, but they know. I mean, Carrie will tell you about her grandfather who would say to us, "My brain is not working. My brain
Yeah.
isn't working the way it used to be." Until he finally passed away at 89. I mean, so he had a long, wonderful life, but he was aware probably a good 15 years.
But I
Okay.
also see folks that we work with who are in their 70s, some in their late 60s, who can notice that their short-term memory might be affected. And so it's not, to Sandy's point, it's not necessarily that there's a drastic drop off in cognitive function. Oftentimes, when it is age related or dementia related, it is a slower, gradual decline. So, to Sandy's point, just to echo that if there is an acute change, that requires immediate attention.
But
Yeah.
but the
That
other
makes sense.
thing, Mary, it's about teaching people to look for clues. Okay.
Okay.
If you come to visit and it used to be that the house was impeccable and now the house is kind of not so clean anymore, or we've all seen either on Instagram or commercials on TV about adult children coming to their parents' houses and throwing out expired food. And we all giggle. But the reality is that if you find milk in mom's refrigerator that's 3 months old, okay, and she's unaware that she's got milk that's 3 months old, that's a good clue for you that
Yeah.
there's something going on here.
But I
Go ahead.
But I think the second piece to your question, Mary, is also about what do you do? And there
Mhm.
are some cognitive changes that are a normal part of aging. And you do need to kind of plan ahead and take precaution and put safety measures in place, but there might not be a drastic thing that needs to be done. So, for example, if you are visiting your parents, your grandparents, and you notice that their pill bottles are still sitting in their prescription packs, that might be an opportunity to come up with a plan for how are we going to help you take your medications routinely.
Yeah.
That being said, if you come in and you notice that you smell gas because they've forgotten to turn off the stove, then that's obviously a more urgent, immediate need for intervention. And so there's a broad spectrum of things that you can see when someone is experiencing cognitive changes. And part of it is the planning ahead, coming up with a plan for, okay, how are we going to manage your meds? How are we going to manage if you start wandering, if you leave the house and go for a walk and can't find your way back home? How are we going to manage if you are leaving the stove on or turning on the water in the shower and not turning it off? Things like that.
Mm.
So
Yeah.
I want to come back to a list of things that we can do for that. But before we go back to that, I really want to talk about, from the medical perspective, the evaluation of that person. Okay.
Okay.
obviously, if there's something acute, you're going to take them to the emergency room or urgent care to make sure that we're not having a stroke, a heart attack, you don't have a urinary tract infection. More likely than not, to Carrie's point, it's gradual. So how do you work up that person? All right. How does that physician figure out whether you have dementia? And I want to come back and say that a lot of people have cognitive changes for
Okay.
a myriad of reasons, ranging from age-related to drug interactions, to the chemotherapy fog, to vascular insufficiency. All right, if you have
Mhm.
high blood pressure long term, you can end up with what is called small vessel disease, where basically part of your brain atrophies because it's not getting enough blood flow to the brain. My
Interesting.
I mean, I can give you a laundry list of these. The point is that there are multiple causes. So, are you a diabetic? Do you have high blood pressure? How well controlled are those things? Because those are things that are going to predispose you to cognitive changes. There is a whole metabolic workup that the physician can do. There's obviously, or maybe not obviously, MRI of your brain. Do you have a brain tumor? Do you have just ischemic changes where you're not getting adequate blood flow? Maybe you had a stroke and you didn't know it, because depending on which part of your brain has been affected, you can have mini strokes. Okay. And not
Um,
either TIAs, transient ischemic attacks, or even an actual stroke. But if it doesn't affect a part of your brain that has a significant function, you may have a series of them before you have a large stroke without ever knowing it. All right.
okay.
And so there's an entire medical workup that can be done in order to sort out, do you have cognitive changes? How significant are they? And what can we anticipate? And then the other thing that I would strongly advocate for anybody who either they themselves or have suspicion that their loved one has cognitive changes is to get neuropsych testing done. That's usually done by a neuropsychologist. It's a battery of tests that evaluate cognitive function, everything from simple stuff like who's the president of the United States to remembering 5 numbers that I tell you now 20 minutes from now. There's a whole battery of these. And
Okay.
in the ideal world, if as soon as you become suspicious, you get that as a baseline, and then it can be repeated in order to evaluate the progression of this over time. Okay.
Okay.
Because most people do not fall off the cliff abruptly. In most cases, people, regardless of the medical issue, most people have this progressive red flag, red flag, red flag before we fall off the cliff. And to Carrie's point about what can we do to keep you safe at home and keep you functioning as independent as you can be, understanding what are the red flags, what's the progression, what's the trajectory of this is fundamental to that.
And that's the neuropsych. That's what is helpful
And
for
that's the
that.
whole workup of this. Yes.
Okay.
And so I think part of your question too, Mary, is how do you get this worked up, and who do you go to? So you can go to the
Yeah.
primary care provider. Ultimately, you'll likely want to go see a neurologist. And then they will likely be the ones to refer the person to have a neuropsych eval done.
Okay. That is really great information. I appreciate it. So if someone is at home and like they're listening and they might be one who are, they're past 70, they're 80, whatever they are, and they're like, are there things that they can think of to help themselves with aging and for reaching out for help? Or is it, or is it harder because it's kind of the brain function? I mean, have you found that people can be good at kind of self regulating that piece of it and knowing when to ask for help, or is that hard?
There are certainly those people who can, either themselves or with support. And so they're coming back to things you can do. Simple stuff like don't have throw rugs on the floor that you can easily trip over. Okay.
Mhm.
Make sure that either your neighbor has a key to your house, or you have a lockbox so that, God forbid, something happens, the fire department doesn't have to break down your door. Make sure you have an up-to-date medication list, and that you know what medications you're taking, and that you are actively communicating with the physicians to make sure you don't have any drug interactions.
Okay.
And so there are a number of these things I'm sure Carrie's going to add to my list. But one of the things we see in particularly in couples who are older, one is frequently covering for the other.
Yeah, I
And
know you mentioned that, and I
and so
can see that happening.
and
Yeah.
so I think that, really it's about honest communication between the partners. It's honest communication with your family members about what your needs are, what
Mhm.
you anticipate your needs to be. Do you want to stay in your home? Are you willing to have a caregiver? Do you want to move in with a family member? What do we think, depending on what this progression is? What does that future look like? And before I turn this over to Carrie to add to my list, the one thing I really want everybody who listens to this to understand is asking and accepting help, whether it's from your family member, your friends, whether it's a caregiver. Putting scaffolding in place will actually help you maintain your independence. People have this perception that if they accept help, that it means they can't do it and they will lose their independence. It is exactly the opposite of that.
Okay. That's really good. I feel like we should repeat that. Because it makes me wonder, and I can see, because of course I have relatives in this age range, so I'm thinking of them as you're talking, and one who has Alzheimer's, so that is a tough one for him for sure, and he's aware of it, like you had mentioned before. But I mean, I feel like maybe you guys tell me you think some fear, some shame, some fear of dying, fear of losing your independence, shame that there's a change going on. I mean, do you feel like that can hinder them asking for help from family members or neighbors, or putting things in place to assist with helping them stay
Absolutely.
healthy?
I absolutely think that's the case. I think accepting change in your functional status is a huge deal. I experienced that when I was 18 and was needing help with showers after I had 3 back surgeries.
Oh,
I don't want to turn this on my mom, but she is a breast cancer survivor and had to lean on the family and my dad for support when she was going through treatment. If you make it to your 70s and 80s and have never had to rely on your community, your family, then you are beyond lucky. Different people have to, my camera wants to keep turning.
it does,
Um,
doesn't it?
Different people have to ask for help at different points in their life, and that's okay. Um, but it is really hard, especially the first time you have to ask for help. And so, again, I do think that's a huge barrier. And I think, just to echo Sandy's point, accepting help allows for greater independence.
Mhm.
That's one of the things I love about the disability community. And one of the reasons that I ended up down this path to begin with was, when you look at the disability community and the social model of disability, it's really that your environment is what makes you disabled. It's not that you yourself are disabled or not able to do something. And by providing a person with the necessary supports, whether that's a curb on the side of a street to be able to get on and off the sidewalk, to using assistive spoons or forks if you have tremors, to be able to feed yourself. These are all just assistive devices or technology or supports to enable someone to live independently. And so accepting help is really one of the first things you can do to live more independently.
I love that. And so I know you guys have provide a lot of just education and stuff for people. So if someone comes to you, whether it's someone who feels like they're losing some help for themselves, or a family member comes on behalf and they reach out to you and say, we need some help. How do you guys help? Like, what are some of the first things? Let's say it's not medical, but they need some. How do you evaluate that? And like, what kind of things can a company like yours do? I mean, you're in Reno in this area, so what? But there's other areas of the country, obviously. So, I mean, what are some of the things that they can get help with that would be, help them stay in their home and, stay healthy?
So I'll take this because I spend most of my days doing this. I think part of it is having an initial conversation where someone who has more experience dealing with aging or different diseases that might impact your ability to navigate your activities of daily living, they can help guide you in a conversation of what can you do, what do you need a little bit of support with, how can we improve the quality of your life, how can we improve your ability to do things independently. And really that starts with a conversation. I think the folks who work in healthcare, in senior care, obviously encounter these kind of situations more regularly. And so they bring a wealth of knowledge and experience, and are a great way to explore what options exist. I think if a person is looking for a caregiving agency to actually step in and help with activities of daily living, making sure that the philosophy of the agency and the approach to care is aligned with your personal values. I like to think that we take a really coordinated approach. My mom has spent her entire career thinking about the biopsychosocial model of health. And we really try to do that here. And I know other agencies across the country really do that. So really aligning values and philosophy, I think, is the second step once you've had the conversation of what kinds of supports could I benefit from, or what tools can I utilize to live well and independently at home.
Yeah, that's great.
I think, Mary, I want to echo what Carrie said, but maybe put a finer point on it. It really starts with that conversation. And obviously, if somebody calls us, we have a conversation with them. We do a free in-home consult to evaluate what their needs are, because most people are overwhelmed. By the
Yeah.
time you realize that you need help, or your family member needs help, it's kind of like the old game of hot potato. I'm managing, and then as soon as I realize that I'm in over my head, I need to do something right this minute, right?
Yeah.
And
I
so
remember you saying that when you came in. It's just like by the time we realize we need help, it becomes urgent.
it becomes
So,
urgent. And so
yeah.
that's part one, but part two, and we also talked about this, the three of us, and that is, there's so much emotion when it's your parent, or a loved one. You're afraid they're going to die. You don't know how to handle it. Then there's, in my case, I have 3 children. When my in-laws were ill, my husband's an only child, so the buck stopped with him, right? When you
Right.
have multiple siblings and everybody has an opinion, and there's this, it can be very hard to navigate. And so one of the things that talking to a company like us, and to your point, there are people like us all over the country. It's not limited to just Reno. We are that independent, um, you know, ear to basically help you ferret out in an unemotional way. Here's where we are. Here are what the options are. And how do I navigate this? And,
Yeah.
one of the problems in today's uh, healthcare world is that people have multiple doctors. There's now a doctor for, the nail on your third finger. And there's another doctor for the nail on your fourth finger of the opposite hand. Okay. And those 2 doctors don't talk to one another. And each one is giving you a list of meds. And so if you're the person who is overwhelmed by this, sometimes just having people around, and this is in part where the patient advocacy piece comes, How do I get my doctor to talk to me? How do I get this doctor to communicate with that doctor? How do I get my insurance company to approve this? What does it mean to be, on a Medicare Advantage plan or an HMO if you're not of Medicare age, as compared to a plan where I can go to anybody? How does the whole system work, and how do we coordinate it?
And that's overwhelming at any age, right? So if you feel like you're somehow your mental faculties are starting to slip a little bit, you immediately have to be overwhelmed. There's no way you couldn't be, you know, with that. So I can definitely see that. So the patient advocacy does come into play with dealing with the medical system, you know.
It
And
can also come into play with the financial system. It can come into play with understanding your explanation of benefits. You get a bill from the hospital and it says that they charged $40,000 and the insurance only paid $2,000, and you can't understand what that is about, or how much do I actually owe. It's every aspect. Health is not just about going to the doctor or a drug.
yeah,
Is your overall well-being, and it affects every aspect of your life.
yeah, man, that's a lot. It is a lot. So I know you guys just gave a talk. Maybe say was it just you, Sandy, or both of you, about staying safe over the winter? So, like, what are some things that you can do to avoid falls and those kind of things that you guys gave that talk about? I'm kind of pivoting a little bit, but
So it was actually Alex and I. So
oh,
there
okay.
are a couple of big things. Obviously, one of the issues is, regardless of where you live, you can live in Atlanta or Baton Rouge, Louisiana, where it usually does not snow, but it can be 35, 40 degrees in the morning, and with the humidity, the ground is slick, and so you can come out and slip and fall. All right, if you are unaware of how slick it can be,
Mm-hmm.
regardless of whether there's snow and ice. So wearing good quality shoes, making sure that the tread on your shoes is up to par. If you are like my husband, who wears his Hokas until they're threadbare, that is a losing proposition. God's honest truth. Um, Making sure that the lighting is adequate. If you're going out
Okay.
at dusk, if you're going out in the dark, turn the lights on around your house. Take a flashlight, wear a headlight, try and make ways not to fall. Inside your house, make sure, as I talked about, that you don't have throw rugs, that you have a night light, and that you turn the night light on before you go to bed, or have a light under your bed that's a motion detector. So that, because especially as it's dark in the morning and it's dark by 5 o'clock at night, you may think, oh, I'm not going to turn the lights on. Turn the lights on. You need to be able to see where you're going. All right. Obviously, especially, make sure you have a clear path around your house. People seem to have obstacle courses, where there's an ottoman in the way, and there's a coffee table, and there's a dog to trip on. So that's fall prevention. One of the other things that we talked about in this talk is this is the height of fall, cold and flu season. Okay. And this is not a political statement, but vaccines, particularly as you age, are super important because our immune systems are not what they were. And the consequence of getting a viral illness is much greater, particularly if you have significant underlying diseases like asthma or COPD or underlying heart disease. So flu vaccine, updated COVID booster. There is now a new vaccine in the past couple of years for RSV, otherwise known as respiratory syncytial virus. Used to be a virus that everybody thought only kids got, but turns out old people, actually young people, actually anybody can get it, and you can get a vaccine for it, and that will make a huge difference. And then the other one is Prevnar, which is the pneumonia shot. It's particularly important if you're going to go visit your family members, or they're coming to visit you, because they're either you or they are bringing a bunch of bugs that you're
Okay.
not used to seeing, and you're in close quarters. All right. And if you have, young kids around you, whether they're your nieces and nephews or their grandchildren, children are petri dishes. And so they are bringing home from school whatever they were exposed to, but you haven't seen that bug in a long time. And so the likelihood of you getting sick is that much greater. So trying to prevent that. The other thing that we talked about was the tendency to eat too many sweets. Actually, the tendency just to eat too much this time of year, whether it's Halloween tomorrow, whether it's Thanksgiving or Christmas. If you're a diabetic, obviously things that are high in sugar, or you're a pre-diabetic, can tip you over the edge. But even things like, Thanksgiving dinner, which tends to be high in salt, if you already have high blood pressure, if you have heart disease, if you have congestive heart failure, can take somebody who's well controlled and tip them over the edge. The other thing to that point is Thanksgiving night is the most significant night in terms of people having heart attacks of the entire year.
Oh, and that's I don't think I've ever heard that
That is
until I heard you say that.
Yeah, and so it has to do in part with the tryptophan in the turkey, but it also has to do with the amount that you eat and the amount of salt. So again, something to beware. And then the last thing we talk about in terms of hazards of fall is really seasonal affective disorder, otherwise known as SAD. And that is really the depression that comes when it's cold and it's dark. And if you think about it, when it's cold and it's dark, there are many days that you don't want to get out of the bed, or you don't want to go to the store, you don't want to go to a movie, or you don't want to go see your friends because it's cold and it's dark and I might as well just stay home. Socialization is super important, all right? Making sure you don't isolate yourself. And then the last thing I will say about that, and I'm sure Carrie will have an opinion because Carrie had a happy light for a long time. But the last thing I'll say about seasonal affective disorder is the need for routine. All right. And we talked at the beginning of this about disrupting people's routines. Well, in the winter, you tend to disrupt your routine because, again, you don't feel like doing stuff. And so if you normally get up, get dressed, put on your clothes, and go for a walk in the neighborhood, even if you just walk around your house, you need to do that same routine. And basically, whatever your daily routine is, that's what has to stay, because that is what helps you maintain your sleep cycle. It's what helps you in terms of your cognitive function, and overall helps with the depression. Okay, Carrie, what did I miss?
No, I
love
think
it.
you covered it all.
Including the happy light.
Including the happy light.
Yeah, I feel like that, the seasonal affective disorder, that's some real stuff, especially in states where those gray, I know I lived in Wisconsin for a while, and I think those gray skies lasted for 6 months. Like there's certain things that aren't helpful at all in any age. So tell me this, I mean, I know you work with families all the time where you're working with the kids trying to help an aging parent. So I'm curious, for someone like, I mean, my mom and her husband do their best to stay very healthy and do all kinds of things. But everyone gets older. So and we have multiple kids in our family, to your point. So for someone like that, where like kids aren't necessarily nearby, there's multiple kids, what are the things that you recommend for families? What do primarily the children, but anyone who's stepping up to help, what do we need to do? And I think you mentioned a few things like, kind of making sure the list for medications there, and making sure everyone has a key to the house, and people are checking in maybe, but are there some other things that you've noticed that would be helpful?
So I think it really depends. And I know that isn't a helpful answer. I think one of the first things, especially if you're early on in your parents' evolving status, is to have a conversation and figure out who is going to be able to step up in which ways. We have a number of families where there are multiple kids involved. And so if one person is really good at finance, maybe that person is going to take over the parents' finances. Maybe one person loves to talk to their parents on the phone. So maybe that person is the one calling every day to check in, or every other day. So figuring out who has which strengths, and which way that they are going to best support mom and dad, I think is one. And then two is starting to talk to your parents and talk about the quality of life that they want to live. If they are having to give up their license because they're no longer safe to drive, if they are not socializing as much because they have mobility impairments, what are the things that you as the kids can do to help facilitate them having independence? Again, it comes back to that idea of having the necessary supports in place to help them live independently or as independently as possible. So again, it comes back to that initial conversation, and figuring out who's going to do what to step up. And then if you are coming from out of town, I think that's a great opportunity to start interviewing different community partners, whether it's a home care agency that can provide caregiving services, whether there are day centers where your parents could go to spend the day and have socialization activities. I think those are some things that you can do during your visit. But ultimately, it depends on what your family, what the kids are able to provide, and what the priorities are for the parents. I'm sure Sandy also has thoughts to add.
I think that in the old days, people didn't want to talk about death and dying or loss of function, or acknowledge that we get illnesses. Or I remember even as a kid that, the C word, cancer, was something that was very hush hush and nobody talked about. Right. I think that the world has changed. And I think that having these conversations early and often before we get to the point of it's a problem, because once it's a problem, then everybody has emotion about it. If you can discuss it before, like now, before it's even an issue, all right, your chance of having that unemotional, so mom, what would you like to have done? I think it's also the reason to encourage everybody, not only your parents, this applies to you, to me, to have a living will, to go through the exercise of thinking about what would I want, okay? And understand that if you have an advance directive, if you have a living will, it is really nothing more than a suggestion, all right? It memorializes kind of what you're thinking, what you want. It doesn't mean you can't change your mind. It doesn't mean that circumstances don't change, but it at least provides a framework. That's number one. Number two, you really need to decide, to Carrie's point, who's going to do what, but more from the perspective of who's going to be the durable power of attorney over finance, who's going to be the durable power of attorney over healthcare. If mom says it's dad and dad says it's mom, if God forbid something impairs both of them simultaneously, all right, then who's the backup? And if it's not memorialized, you don't have enough, there's no backup. And then it becomes the state. So again, it's here to have these conversations in advance and be realistic. Okay. If you are the kid who lives far away and there's a kid who lives nearby, chances are it's the kid who lives nearby that's going to go to the doctor more easily than the kid who lives in Thailand.
Right.
And so when you're sorting out who's going to do what, think about that. The only other thing, Carrie, that I would come back and take issue with, it's not a kid who's going to do the calling every day. Set up a schedule where every kid calls, every other, like a rotation. If there are 3 of you, each one of you takes 2 days a week. Okay. It is one of the things that we see repeatedly, and I've seen in my medical practice, is that people get burnt out. And I said something to you, Mary, and I've said it to Carrie, a number of times that is very crass, and I will apologize for in advance. And that is, on some level, many family members end up feeling, okay, if you're going to die, can you just hurry up and die quickly? Because we can all do anything for a day, a week, a month. The thing that wears folks down is chronic illness. And because medicine has evolved so much, we've gotten so much better in keeping people alive for a longer period of time. The getting sick and gradually declining is over a longer period. Well, that kid who can put their life on hold for 2 weeks to go take care of somebody may not be able to do it for 6 months or a year or 5 years. All right? There's no guarantee the time frame in which this happens. And that's where understanding what the contingency plan is going to be is so important. And to come back to Carrie's point, if you live out of town, all right, going to look at the various, whether it's the independent living, assisted living places, whether it's figuring out who the community resources are, whether it's interviewing companies like us, talk is cheap. It does not hurt you to line up all of this stuff, understand what's out there, because when you are in an emergent situation, it is too late to first be scrambling to try and figure this out. You really
Yeah.
want to think about it preemptively.
Yeah. I really appreciate that advice. So, the living will is one you said, and that can go into, what medical decisions you want to have made, is what I'm understanding, yes?
Yes.
And then just making a, because the how long it will take in this state of not being able to fully care for yourself is we don't know that timeline. And I feel like that's another just thing that we can think about, both my age and boomers can think about, that's they're aging right now. So I really like that. I really like that idea. And so if you are like listening and you are, the boomer who's, you feel fine right now, but you kind of are going, maybe I should have some things in place. But maybe it's the opposite way, where your kids have no desire to talk about this. What should you do if you're the one where you're like, I feel like I should just maybe have some plans and some things in place, and what ideas would you have for them?
If you're independent enough, you can go out and do this on your own. You do not need to involve your kids. I mean, I would tell you that I know personally multiple couples, multiple individuals who have gone and ferreted out what their options were and then said to their kids, this is the plan.
I think the caveat to that, Sandy, is you want to make sure whoever is your durable power of attorney, especially for healthcare, is someone that is on board and obviously agrees with your wishes. But I agree. Otherwise, if you are able to, you can go out and evaluate all of your options on your own.
Yeah, I think absolutely, Carrie, you have to have their buy-in, but the point is you don't need them to take you or go with you. It's a two-way street. All right. And I think that a lot of the time the kids are afraid to bring it up to the parents because it makes the kids uncomfortable.
Mm-hmm.
And so saying out loud, you and I talk about it all the time, saying out loud, hey, I know this time is going to come. Here's what I'm thinking. Here's what I would like. Here's what the plan should be. Is a two-way street, a two-way conversation, right?
Mm-hmm.
And so if you're up to it, you can do the research on your own and then present it to your family. Or you can say to your kids, I realize this is what's happening. I think the one thing that Carrie said that bothers me a little bit, if your mobility is an issue, then the $64,000 question in my mind is, why is your mobility an issue? Is there some underlying process here that we can do something about? Hey, mom, have you been evaluated? Do you need a knee replacement? Do you need to go to physical therapy? Is it a function of getting you a trainer? Can you do sit and be fit? What are the options to deal with your,
Mm-hmm.
all right? And I think regardless of what medical condition or what the situation is, it really boils down to that serenity plan, prayer rather, meaning Is this something I could do something about? If so, let's do something about it. Is it something that I have no control over? Okay, then let's acknowledge I have no control over it, and let's put in a plan to compensate for the thing that I have no control over. But I think
Mhm.
regardless of what the underlying set of issues is, the very first question that either you or your family member should be asking you is there anything about the situation that we can change? And if so, what is that? And if not, then okay, how do we problem solve given the circumstances that we have? And
Yeah.
that's where it's a two-way conversation.
No, that's so brilliant. I actually like the misspeak you did with the Serenity Plan. I think I think maybe you should write a book called The Serenity Plan and reference that, and because that I mean that kind of does boil down to that, right? If there's can we do something about this, then let's do it, and can we not do something about it, then let's have it in the plan for when that time comes. So, and I do think it really does boil down to that we don't want to talk about we don't want to talk about death. We don't want to acknowledge death. We don't want to acknowledge that that's a thing that's going to happen to us all at some point. We certainly don't want to think about uh, all that's involved in it. So, part of life. And so on your way, I guess that's the serenity plan, but not that and we don't want anyone to go before their time. So how do we stay healthy and comfortable and as we age.
And so,
Right?
Mary, one of the things that I've said for a very long time to pretty much every patient I've ever had, but including the ones who have been dying, and that is nobody controls how long you live. The only thing that we control is the quality of the life that you have while you are living it. And
Mhm.
and the same thing is true even of dying. Dying does not have to be a terrible or a scary thing. You can have, you know, a good quality death, as crazy as that may sound. It's all about how do we help you from the moment that you're born until you ultimately die, have the best quality of life, regardless of how long that life is.
That's so beautiful. I'm definitely putting that out as a social media clip. That part right there. Well, and that's actually part of the reason I'm doing this podcast is like, the aspect of healthy living from cradle to grave. And let's talk about all of it and not, get caught up in fear or, anxiety or any kind of stigma, shame, whatever that stigma is, and then also about all the financial thing and how we can live a big, beautiful, healthy relationship, healthy body life. You know, with regardless of things that go wrong. Like, and what I appreciate so much about both of you is you both have lived through stuff. You have a lot. I mean, probably even before you lived through your medical challenges, had compassion because you have compassion, and just by listening to you, you have a lot of intelligence and wisdom. So it's very helpful to have those two things paired together to talk through all these things. And I know you're a huge benefit to all of your clients for that, for sure. So, do you have any other I know we've been going about an hour, so just kind of any thoughts that you have about anything else we haven't talked about? Um, Staying healthy and happy over the holidays, over the winter, things we can do, conversations we should have with people of different generations, anything that you can think of along those lines?
Everything in moderation.
That's a good one.
Everything in moderation. Exercise, because most people, not only do we overeat, but we tend to do less because it's cold and it's wet, unless you like to ski,
Yeah.
right? And so bad combo. The other thought that I'll put out there that is purely a medical thought that I spoke about the other day in hazards of fall, and that is Tylenol hangs out in many over-the-counter drugs. Whether you have a headache and you take Tylenol, whether you have a cold and you take Dayquil or NyQuil, Tylenol hangs out in a bunch of over-the-counter things that you never think about. Tylenol can be liver toxic.
Okay.
And in moderation, less than 4 extra strength Tylenol a day, you should be fine unless you have underlying liver disease. But Tylenol is liver toxic. So if you like to drink, and when I said this the other day, my husband was like, "You mean alcohol?" Yes, I mean alcohol. Right? I was like, "What else? What else could I mean?" And his response, "Well, there's like water, there's seltzer, there's like," I'm like, "No, I mean alcohol."
You're
So
so funny. I love
if
that.
you drink alcohol, right? Alcohol is also metabolized in the liver and can be liver toxic. And just as a news alert, one of the first liver transplants I saw at UCSF back in 1989 was a young guy who had taken Tylenol and drank several beers and basically needed a liver transplant.
Oh, that's
Right?
horrifying.
And so people drink too much, they get a headache, and they take Tylenol to deal with their headache, and you can kill your liver. So
Mm.
if you are going to drink, do not take Tylenol, whatever you do. That's the end of my tips.
That's great advice. That's super great advice. For any age.
For any
good
age.
advice for any age.
Yeah, 21 and older, maybe even
You know,
some younger.
That made me remember I did have a specific question. So the durable power of attorney, is that part of the living will? Is
Yes.
that included in that? Okay.
You would get that signed up at the same time.
Okay. I
Yeah.
just had that specific question. So now we know.
And there's general durable power of attorney. There's durable power of attorney that it is specific for finance, and then there's over healthcare, and they don't all have to be the same person.
Okay. And did you have ideas on what you would want people to sign up for? I know this is Medicare season 2, so that you would want them to sign up for and not want them to sign up for? I know I did have someone on the podcast who talked about all that too, but as doctors.
As a physician, we call Medicare Advantage Medicare Disadvantage. And so you have to understand why. The way in which Medicare Advantage works is Medicare does not want to administer Medicare to everybody. So they give private insurance companies like United Healthcare, Aetna, Humana, Blue Cross, a certain amount of money per life to take care of Medicare patients.
Okay.
So when you sign up for Medicare Advantage, there's often this come on because they're going to give you vision and dental and prescription and a lower premium. So let me start with there is no such thing as free lunch. All right. If you are getting a lower premium and you think you're getting all of these free things, all right, you should be thinking to yourself, why are they giving me all of these free things and Medicare won't give that to me? It's usually because, number one, there is a network, which means that you have to go to only a doctor within that network.
Okay.
So if you live, for example, in Reno and you sign up for locally here, for example, Hometown Health, it's a closed network. So if you go visit your child in Southern California, that you can only go see a doctor if it's an absolute emergency because they're not in network. The same way if you're not of Medicare age and you get an HMO, okay, if you can only go within your network. It's number one. Number two, you typically need a prior authorization and a referral to see any kind of specialist or to get any kind of test. Okay. If you have plain Medicare, not Medicare Advantage, you can go to any doctor in the entire United States who takes Medicare without a referral. So it's what we call an open network. And you do not need a prior authorization or a referral. So if you need an MRI of your knee, you can call up the orthopedist, go see the orthopedist. The orthopedist can order the MRI of your knee and you can just have it done if you have Medicare. If you have Medicare Advantage, you're going to have to go to your PCP, who's going to then refer, if he's willing, or she's willing, refer you to the orthopedist, who then has to jump through the hoops of proving that you've had X, Y, and Z treatment before they'll approve the MRI of your knee. Why is that? It's because the arbitrage between what Medicare pays to a Medicare Advantage plan and what the Medicare Advantage plan pays to take care of you, right, is the profit that the Medicare Advantage plan makes. And
Yeah.
there is no business in the entire United States that is in the business of losing money. So whether it's Blue Cross, United, Aetna, doesn't matter who it is, okay? I promise you that there is some bean counter who has figured out that by denying or delaying your care, that they can save money relative to what Medicare gave them. And that is why most physicians that you talk to, if not all, will tell you you should stick with straight Medicare A and B. Medicare A covers hospitalizations, Medicare B covers physicians and outpatient treatment. And basically, people are always worried about, oh, with Medicare, I have no limit. Well, the reality is that you have a $250 deductible. All right, that's what the Medicare deductible is. And then, yes, you are on the hook for 20% of what Medicare allows. So if the doctor charges $500, but Medicare says that the allowable is $100, the most you would be out of pocket after your deductible would be $20.
Okay.
And so people are petrified that if they had straight Medicare, that they would be exposed to an unlimited expense. That is not the case. Okay. And you can get a supplement, Medigap, that will cover that 20%. So
Mhm.
if you are somebody who has significant medical needs, if you want to be able to go to whatever doctor you want to go to, if you want to be able to travel, let's say you have one kid in Wisconsin and one kid in Iowa and one kid here, and maybe you are going to spend 3 months in each place with somebody, plain Medicare is the way to go.
Yeah.
If you are healthy and you're an underutilizer, then Medicare Advantage may work for you. The problem, and I'll come back to what we've been talking about all along, none of us know when we're going to fall off the cliff. Right? I mean, I was an absolutely healthy 61-year-old who went for a routine yearly mammogram. Had one a year before that, absolutely nothing, and found to have this breast mass. All right. No symptoms, non-palpable, minding my own business. You do not know when you're going to fall off the cliff. So this idea of, well, I'm healthy, so maybe I don't need this, that is truly a misconception.
Yeah. I appreciate all that. That's good advice. Oh,
Yeah.
so I appreciate that so much. Carrie, what other thoughts do you have for everyone, especially
So
in this season?
I think that two things. One, I think the holidays are a wonderful time to be with family. And I know that as I've gotten older, I've come to realize that all of the stories that I heard when I was a kid are stories that I have vague memories of. And so, just in terms of really having an opportunity as an adult to spend time with family, it's really important to ask your grandparents, ask your parents to tell stories. It's
Yeah.
really good for them to be able to share those memories with you. But I think it's also really fulfilling as the younger person to be able to have an updated recollection of those stories. So I think that's really valuable, especially over the holidays and with family traditions. And then the second thing I think is relevant to the conversation we had earlier about durable power of attorneys is something called a POLST. And a POLST is a medical order. It stands for Provider Order for Life Sustaining Treatment. And it is a valuable tool for really every single person to have because it is a medical order outlining your wishes. And it is typically used in emergency situations. When you have an advance directive, they might be 20 pages long. And in an emergency, you want to get care as quickly as possible. And so, assuming that you are unresponsive, emergency response personnel will begin CPR. If that is not something that you want, then having a POLST is really the only thing to prevent you from an attempt at resuscitation. And so I really encourage everyone that we work with to have a POLST. I gave a talk
And
a few weeks
how do
ago.
I apologize for interrupting. How do you spell that?
POLST.
POL, POLST, POLST.
Pol, yeah.
I've never heard of that. Thank you for
Yeah.
sharing that.
Well, and I actually talked to a mom who had kids in her 20s or kids in their 20s, who attended a talk I gave a few weeks ago. And as soon as the talk was over, she thanked me and said, "I'm calling my kids right now and telling them to get a POLST because they lived out of state and did not have family who lived near them. And so if they ended up in the hospital, she wanted to make sure that providers knew what they wanted, that they wanted full treatment, that they wanted everything that could be done." And that is the base assumption. And so if you are someone who wants everything done, then it's still equally important, but that is the base assumption. If you do not want to be intubated, if you don't want to go to the ICU, then having a POLST will make sure that your wishes are respected. And so that's why it's so important. And again, it's not instead of an advanced directive or a living will or a durable power of attorney. It's a complement to those tools.
All right.
But I just want to add one thing to that so that people are crystal clear. An advanced directive / living will is what you would like, number one. Number two, it is usually a document that is 20, 30, 40 pages, and it is almost always buried in somebody's safe, in a drawer, nowhere than anybody can find. If 911 comes, all right, they're not looking all over your house to see if you have a living will, number one. Number two, follow up back to, it's just your wishes. It can say that you don't want this, that, and the other thing, but if you're unresponsive and there is not a POLST on your refrigerator or easily accessible, the EMS folks are still going to do a full court press. A POLST is a signed medical order by a physician. So it is a legally binding medical order so that you can actually have your wishes implemented. Again, it has to be someplace that can be easily found. If it's in your drawer, nobody's going to look for it.
Right. Fascinating. All right. Thank you guys so much for coming on, and I'm wishing you a very happy Thanksgiving and Merry Christmas and Happy Holidays, all those things, even though I will talk to you again. But for right now.
Thank you for having us.
And
Yeah.
we hope you have a great holiday season with your family.
Yeah, thank you. Well, appreciate you guys coming on, and comprehensivehomehealthsolutions.com is your website. Any other ways you would like people to reach you if they are needing services or needing your wisdom or wanting you to talk or anything like that? Because you give speeches too, so.
Yeah. Calling us up is probably the easiest way, 775-624-8939. You can also find us on Facebook and LinkedIn. And Carrie will tell you that both of us tend to be available what seems to be 24/7. So call us, send us an email, reach out to us on our contact page. We'll get back to you with whatever answers you need.
All right. Thank you so much.
Thank you.
Did you like that? You can watch more episodes here, subscribe over here. We actually have new episodes with awesome guests every Thursday, so check back in. Is that all?